educational preparation and background was a diploma grad, and I graduated in 1973. And through the years, I found that I needed more education, mostly because in case management, I went to a management role. So I ended up getting a business management degree and then a master's in healthcare administration. Prior to that, I worked in home care for many, many years, and prior to those many, many years in various settings, hospital and nursing home. So I have quite a background in nursing.
I've been a nurse since 1983, and I've been in case management since 1992, and I'm a certified case manager since 97. In the ambulatory care coordination, I'm a nurse case manager working with the primary care physicians.
My educational background is I'm an MSW. I went to Boston University and received my master's in social work in 1992. I am the polytrauma TBI and spinal cord injury program coordinator.
My educational preparation background is a 3-year diploma program followed by junior college. I work for a large insurance HMO managed care plan.
I'm a registered nurse and a certified case manager. I'm a workers' comp case manager.
I started as an ADN nurse and got my RN on the second try. Then started back in a BSN program, but switched gears and went into healthcare administration for a baccalaureate degree, and then I have a master's degree in organizational management. I'm independent. I do a lot of consulting in hospital systems, managed care organizations.
I have a degree in nursing, and I became a nurse in my early 20s. I changed from a degree in education and switched to nursing, which I have enjoyed. I started out in a nursing home because in the early 90s there were no jobs, full-time jobs for nurses. Even though we were told there was a shortage, there were no full-time jobs for nurses. I loved long-term care but wanted to get into acute care. So I began working in a hospital, and I ended up working in an ICU a couple shifts a week. Building a house next to a woman that owned a medical case management company. She encouraged me to work for her. She took me under her wing she was my mentor, taught me about case management, and I decided to go into it full time. I loved working as a case manager for patients. Currently, I'm still in case management. I work only in the workers' comp field. Currently, I own my own medical case management company. I've been in the case management field for 17 years working with workers' comp, injured workers, and 5 years ago I started my own company. Many adjusters, different insurance companies said to me, when are you going to go out on your own? And I had the fear, but then I decided just to let fear go, and it's been fabulous. I have 6 nurses working for me, all throughout New England. And I don't do a lot of marketing. I'm not trying to brag. I don't do a lot of marketing. I've been around a long time. A lot of people know me and know our company values, which we are basically just patient advocates, which is a simplified way of explaining what we do. But really, if we get the patients good care, quality care in a quick manner, they get better more quickly with less complications, and insurance companies end up saving money, which is what they really love.
My educational preparation and background includes a bachelor's in nursing from Fitchburg State College and also a master's in business administration from Clark University. I currently work in a community setting supporting a large number of physicians in the care of high-risk patients.
I have a bachelor's degree in health policy and management and a master's degree in social work. And I've been working in the social work field for 15 years. Most recently, as a case manager, I've worked in the Veterans Administration.
I have an undergrad, a bachelor's in social work, and I'm also a licensed LI master's, and I'm also a certified case manager. The setting I currently work in is in the Veterans Affairs. I work for the Providence VA Medical Center.
My preparation is as a registered nurse. I have a bachelor's degree and a master's degree in nursing. I've worked with so many case managers in so many different fields and educational preparations. I currently work in a managed Medicaid setting, which is really very challenging. We're a very hands-on department. and really reach out to our members to where they are.
I have a bachelor's in nursing from the University of New Hampshire, and I also have my MBA in healthcare management. And my background is medical surgical nursing, oncology, orthopedics, and critical care, and most recently case management.
I went to Quincy Junior College and got my RN there. I went from there to Northeastern University, where I got a certificate in healthcare management. After that, I went to UMass Boston and got a certificate in gerontology. All of these to help me in my career as a case manager. I work for a large practice on the South Shore. It's a group practice of 40 providers, and we handle patients from pediatric to geriatric.
I started out first in counseling, and I worked and got my master's in counseling. And then I made a career change and became a nurse and got my bachelor's and my master's. And then I ran into a person who became my mentor, and I moved into case management. So I moved from managing and working a program with traumatic brain injury into case management, and that's when I started my career. I started out in rehab, and I am now back in acute care hospital.
I am a registered nurse. I've been a registered nurse for 40 years, and I started off as a diploma nurse, went to a hospital-based school, went on to get a bachelor's degree in healthcare management, and have received a master's degree in nursing administration. And my employer encouraged me to go on to get my certification in case management. So I'm a certified case manager as well. Currently, I work at an insurance company, the setting that I work in. I am a case manager, and I do a lot of utilization management as well.
My educational background is certainly wide and varied. I started as a candy striper in a hospital and worked as a CNA, got my LPN, RN, my bachelor's, went to get on a master's in business administration, also a master's certificate in health administration, and also went and got to my certification in case management. I currently work in acute care, which is my preference. I have worked in long-term care, but I am back in acute care and actually am the director of a case management department.